The healthcare detective Frank Lalli has written a book for Simon & Schuster about how to get affordable healthcare, called Your Best Healthcare Now. It is available online, in-store, wherever fine books are sold. Mr. Lalli is also the health correspondent for Parade and the former editor of Money and George magazines, which makes me think he knows what he's talking about. Hi, Frank. How are you?
I know what I'm talking about when I do a little reporting, which for you. So here's what I looked into this week. The Trump administration is scrambling to come up with ideas to cut drug prices, and they want to make not a lot of announcements before the election. They're actually the acting chief of staff. They're all acting down there, and I wish they were better actors. But anyway, they're all acting down there. So the acting chief of staff is meeting weekly now with the son-in-law in chief, Jared Kushner, the head of Health and Human Services. That's a guy named Alex Azar III. And others, anyway, from Pence's office, having meetings. They're somewhat contentious meetings because they're debating these ideas. Each of them have some good points, have some flaws. No great agreement yet, but here's what you can expect. Until the election, you're going to hear ideas coming out of the Trump administration about one every 2 weeks, about wonderful new ideas about how to knock down drug costs, how to knock down health costs. Okay, fine. But sadly, based on my reporting here, I don't think anything really big and significant is going to become law before the election. There'll be some help, but more announcements that actually go nowhere rather than real results. For example, you may already heard that Trump may sign an executive order to create universal flu vaccine. That'd be right. That'd be terrific. You take a flu vaccine just once in your life, not every year, and it would be really effective. That would save a lot of money. It would save lives. Sounds great. Okay. When that executive order comes, read it really carefully, because you're going to see that the government is not proposing to put up any money, no financing, not a penny in financing to help the drug companies create this. So drug companies aren't going to take money away from something else that they're doing to do this universal flu vaccine without substantial government investment. So that's an executive order. That's an executive order. I think it's a lot of hot air executive order, and you see where I'm headed with this. So look, a lot of ideas being debated, and there are problems with each of them. I'm going to tick off a number of them today. So another very hot topic is allowing you and me to finally import drugs from Canada. And that would be very good. Canadian drugs are about half U.S. price, and even less in some cases. So Health and Human Services, that guy Azar, he says, last year I thought importing from Canada, gee whiz, I call that a gimmick, all right? But you know what? Trump has called me 43 times, and now I think it's a really good idea, and I'm really open to ideas. And here's the punchline: from the states. So you see what they're doing here? This is not a national order to allow anybody all over the country to import drugs from Canada. We're going to go state by state giving waivers, and the state has to convince us they have a really good plan to bring it in from Canada. Otherwise, you're not going to be allowed to do it. You can see that it's going to take forever, right? Each states have to come up with these laws that would allow them to import. Then they got to get a waiver from the HHS. So Florida, Maine, Vermont, they got a leg up. They already have laws allowing them to import if they get a waiver. But Connecticut, New York, Massachusetts don't even have that. Okay. Second of all, the government is not proposing that all drugs come in from Canada, not all drugs. And they're excluding very expensive drugs, the oncology drugs and drugs for other chronic illnesses. Cost a lot of money. That's where you really need a discount. They're not in this plan. And neither is insulin. Okay, that's a really big omission, because we talked about this, Jill. I mean, people in the United States, there are about almost 8 million of them, need insulin to really stay alive. And they're rationing the amount with their diabetes. They're rationing the amount of insulin they're taking, risking the health.
Right, and you did
a show. In some
cases,
even dying. because they're paying 10 times what the drug would cost in Canada in many cases.
Right, and we did a show on this, and there was a solution. I just so just what did you? There
are some ways around it, but
just to the insulin. I thought that there was something specific that you recommended that people do.
Yes, there is something specific. Right. You can import from Canada right now. They keep this pretty low. Okay, you can do it legally. You see people driving over the Canadian border and bringing it back. That's legal. You can also do it mail order. It's legal if you just get small amounts. It's got to be for personal use. If you get cute about it and try to bring in too much, that's when the feds will knock on your door. But you can import small amounts. But excluding insulin from a plan like this is just tremendously galling to me. Not only the fact that
it's the practicality of it. Once again, this is just me jumping, and I apologize, but forcing people to read the small. It's enough to manage an ailment. Having to read the small print on top of it is the outside. It just takes it beyond the pale. So.
And the thing that really upsets me personally about it seems so underhanded. I mean, here's Azar, this guy who used to run Eli Lilly, and now he's saying Americans have been paying exorbitant prices for health for their drugs, and we're going to do something about it. Well, while he was running Eli Lilly before he got this gig down in D.C., he doubled the price of insulin. Helped him make $10 million a year, okay? So if Mr. Azar is looking for solutions to a problem, he should look in the mirror, because one of the problems is staring him right back in the face. So it's very galling to me. And I talked to the head of T1 International. This is a global group that fights for low insulin prices all over the world. And the head of the Connecticut chapter, that's Kristen Whitney Daniels, she told me that, look, this whole importing thing is ultimately a distraction from the real issue. Here's the real issue. Insulin costs too much. Not only does it cost too much, but it's doubled in price. And not only that, it continues to go up 10% a year. That's a real problem that Azar should be putting his nose into instead of the smokescreen of the imports. And he's not allowing insulin even into that import program. All right. What's more, Canada is against it. Canada is against exporting drugs to the United States because the leaders up there say, hey, have you guys noticed? I mean, Canada is only about 1/9 the size of the United States. We're talking about 37 million people. That's all we are up here. And the idea of Canada exporting, they say, look, that's like a mouse giving a transfusion to an elephant. Not going to work, guys. The mouse is going to die. And along the way, there are going to be shortages in Canada. There are already some shortages. It's going to get a lot worse if they're exporting into the United States. And the prices of the drugs are going to go up because of the increased demand. So you're not even going to save that much money. So how about this, Jill? So the Trump administration hears all that and they say, okay, hey, how about this twist? What if we allow U.S. drug companies to import its own products from Canada? How does that strike you, Jill?
Interesting.
Okay, what incentive would the drug company have to import a $10 drug from Canada, right? They charge $10 for it here when they're collecting $100 for the very same drug right now. Why would they import? Why would they compete with themselves?
You're not supposed to use logic. Don't do that. But I'm sorry to digress, but you take anything that you're trying to fix. More time and energy, mental and otherwise, is spent trying to keep those wires from touching than in solving a problem. So, sorry.
This is a short in every other way. So. Here's the best I can say about this importing idea. The Trump administration is making a plan to make a plan. That's about all they're doing here. And I don't expect anything significant to happen on importing for the next 2 or 3 years, right? And there'll be election in between. So I'm not sure this importing idea is going to go anywhere at all. But hey, that's not stopping the administration. We got other ideas. Like you've heard of this one. They're going to force the drug companies to disclose the price of their drugs and all their TV ads. Well, that one has already come and gone. The courts have already struck that down. They've killed it. So, okay, administration, no worry. No worry. So that didn't go anywhere. How about this one? How about an executive order barring Medicare from paying more than the drug's lowest price in the world? Trump really likes this idea. Medicare cannot pay a penny more than the lowest price in the world for any drug. Well, there's a little hitch.
Yeah, but again,
A little hitch. They have no idea about how to enforce it. And once again, it would not apply to the highest priced drugs. So if he signs that executive order, it's going to be at the margins. You want another one?
One more, because there are 4 minutes left, and I would also like to know, I'm sure you can get more than one in. I'm sure there are 65 of them. And I would like to know if there's anything, other than bemoaning the fate of trying to solve anything.
All right, I'll give you one. I'll give you one more, and this is another one that I think is going to come and go. They want to force the middlemen negotiators. These are the benefit managers, prescription drug benefit managers. They stand between the drug makers and the insurers. They get big discounts from the drug makers, and they want to make sure that those discounts are not given to the health insurance companies, as they are now, but really go directly to consumers. All right, sounds really good. Azar's really for it. Trump thinks it's a wonderful idea. Guess what? No idea how it would be enforced. And furthermore, the health insurance industry and the benefit managers are dead set against it. So they'll be lucky to do anything at all there. All right. Look, as you say, this is so bleak. There's got to be some good news here. Trump has got to announce something, right? So here's some things that might actually happen with bipartisan support, at least to help the people with Medicare. So one idea, and Jill, you and I had talked about this for years. One idea is to finally cap Part D Medicare drug prices at some level for 1 year. Right now, there is no limit, right? The sicker you are, the more vulnerable you are, the more expensive drugs you are, the higher the bill, and there is no cap, okay? So they want to cap it, one idea, cap it at $3,100 for a year. I think it should be lower. Corporations cap for their employees in some plans at about $1,000. But anyway, they're saying $3,000. At least there'd be a cap. But not until 2022. Come on, guys. We need relief now. You can't put it off until 2022. But let's hope that something happens there and it can be moved up a lot sooner than 2022. The other one is, this is actually Speaker Pelosi out of the House and other Democrats pushing once again to finally allow Medicare to negotiate directly with the drug companies and get discounts. The VA gets about a 40% discount now, okay? But Medicare by law is not allowed to do it, and that's because Republicans have said that's price fixing, we're not going to allow that. If nothing else is happening, Trump, in these little meetings that I described at the beginning, where Jared's there and Pence and all those guys talking about ideas, Trump pokes his head in the door and says, you guys don't come up with anything. I'm going to negotiate with Pelosi, and I'm going to allow her to finally allow Medicare to negotiate. I was for it when I was a candidate. You remember? And then I forgot I was for it, but I just remembered that I actually was for it then. So you might get a break there, and that would help. So you got two possibilities: capping drug prices at some level sooner or later, and maybe finally allowing Medicare to negotiate. So it's not a rosy picture, but it's some things may happen before the election. And let's hope so.
And in the meantime, there's nothing to do. We've got about 30 seconds.
You can, if I would say to people with diabetes and insulin problem, which I think is so severe, I think you really should look into the possibility of even mail order 90-day supplies of the drug from reputable Canadian pharmacies. They can be found. And if you keep the order down to a 90-day supply, it is legal. Okay. And at least you'll get a break there. If you live close enough to the Canadian border, or then you can just drive across the border and buy your insulin there. And that's at least some help. Here's what we will pledge here at Robin Hood Radio. I'll stay on this story. And if we get some hopeful news or we get some news that will mislead you, we'll report it.
Thank you, Frank, the healthcare detective and the health correspondent for Parade. Send your questions or concerns about finding affordable healthcare to healthcaredetective@robinhoodradio.com. Frank will try to address as many of your questions as he can on future broadcasts. Also, look for his book, Your Best Healthcare Now, available online, in-store, and on my desk.